and then we'll take questions. So I'll try to keep my portion of this fairly short. So, Healthy CT. I guess this should work and move me forward. And you can't see that. That's great. All right, well, see, we're that new. All right, so where did this entity come from? Well, the entity comes from an opportunity that was defined in the Affordable Care Act. Of the 2,200 pages, this was about 6. So where the money comes from to do this is part of that. So part of the bipartisan agreement in Congress to create this new law was the Democrats wanted to have a different type of approach to health care. They wanted a public option to exist everywhere. And the Republicans wanted free enterprise to continue to drive our healthcare system. The decision that was finally made was, okay, there's a bill that comes out, and it has, as Jason mentioned, it's extensive changes to the insurance industry. The 6 pages that identified co-ops basically put a fund of about $6.5 billion together, and basically said in the legislation that it would be available, this money, on a loan basis, not a grant, on a loan basis, would be afforded to entities within all 50 states to create brand new health insurance entities, payers, and compete in those local markets. Now, there are a lot of regulations that came with the ability to do that. It had to be a not-for-profit. It had to stay a not-for-profit. It can't flip and create a foundation and turn it into a for-profit. And it needed to provide a lot of different aspects of how it would be governed. So this thing is called a co-op. Now, the co-ops have been around for lots of years. They started after the Depression, mostly agricultural in nature, to aggregate opportunities for individuals. Well, this is a consumer-operated and oriented plan, COOP. And the consumer side of that is very large in the bill that was put forward, i.e. consumers, i.e. members of the plan, become the board of directors. So this is an opportunity, the federal government put forward an opportunity to have consumers help govern these entities that were going to come forward. So that bill was passed in 2010. This portion of the bill really didn't start making news until 2011. I was actually at a conference in Boston where we were actually from, now again, take my step back, and I was running the IPA at the time. We were actually doing a presentation in Boston on accountable care organizations, which are also part of this bill. And many of you may be part of accountable care organizations that are beginning to flourish a bit in the state of Connecticut. I think we have 5 that are in the state and 2 on the outskirts of the state. So we were doing a presentation on where physicians had opportunities within accountable care organizations to take a bit more control of the healthcare system. Well, also at that same conference was an attorney out of Chicago, and he did his presentation on co-ops. So I was there at the meeting with Matt Katz was at the meeting, my medical director Ken Sachs was at the meeting. And we sat there and watched this presentation and said, you know, well, we have a 7,000 physician network in the state of Connecticut. Gee, that's one of the big leaps that an insurance company certainly has to do, is to have a network of physician providers and non-physician providers. So we kind of looked at that and said, you know, many of us have challenged the insurance world a bit, depending on what we've all done, and many of you in the room have done that.